I really got sold on becoming a surgeon when I spent a summer with a family friend who was a general surgeon actually in South America. And I spent a few months walking around the operating room with him and realizing that surgeons can have a really powerful impact on their communities, and that really every day they were confronted with a different challenge, whether it was a technical challenge in the operating room or a personal challenge with a patient who's having a difficult time. And I really found that to be rewarding work, and that's kind of when I decided that I wanted to be a surgeon. My name is Brian Swendseid. I'm a head and neck surgical oncologist at MD Anderson Cancer Center at Cooper. I primarily deal with patients who have benign and malignant tumors of the head and neck, so that can involve the voice box, the throat, the tongue, the thyroid, skull base, skin, pretty much anything in the head and neck that's abnormal is something that I would deal with. I primarily deal with the surgical side of that, but I work with a team of radiation doctors and chemotherapy doctors, and we all come up with a personalized plan for whatever that patient's disorder is. The head and neck is just such a complicated area. All your senses are there. Your cosmetic appearance to the outside world is there. So cancer can be really debilitating. It can really affect your self-esteem, your ability to enjoy life. And so, one of the things I like about working on both sides of these disorders, which is taking out the cancer but also reconstructing, is trying to restore people's ability to do what they like to do. Every patient, every cancer is different, so none of this is cookie cutter. So every time I meet a new patient, I try and understand where they're coming from and what their life is all about, and try and understand how this disorder is going to impact their livelihood. And part of that process is developing a personalized plan that makes sense with their life, makes sense with their wishes. Personalized medicine is huge in head and neck cancer now. We're able to sequence the genes of these tumors and figure out exactly what types of chemotherapy agents will be effective against one patient's individual tumor. We're able to do minimally invasive techniques using the robot to take out tumors that we previously couldn't access. And there's lots of clinical trials that are ongoing to help figure out what the best treatment plans are going to be, and in which patients can we scale down treatment. Instead of giving them so much radiation, are there certain patients that we can give less treatment and therefore give them less morbidity in trying to cure the cancer. The patient population is very diverse. I'm fluent in Spanish. I used to live in South America. I did that for 5 years, and so I just love working with patients where I can speak Spanish, and speaking to them in their native language I feel like helps me form a strong connection with that community, and that's one of the great things about working here.